Hey YouTube family, it's Sarah. I'm really excited today because today starts off my extravaganza of Surgiversary videos. My 1-year Surgiversary is coming up at the end of the week, exactly 1 week today actually. And not necessarily to celebrate, but I guess just because I know when I was watching YouTube videos, it always interested me watching people's journey at a year out and what they were eating and what they had learned and all that sort of stuff. I thought I would try and make a bunch of videos around this time that hopefully will be helpful to other people. And also, I guess, just for myself as sort of a record of where I'm at and where I've come from. So today I am doing one of the videos that I think is probably what I get asked the most about, either here on YT or on Facebook. And that's basically what I'm eating. So everything from how many calories I eat, what my macros are like nutritionally, how much I eat, what types of things I eat. And so I'm going to talk all about those. I have a feeling this will be a 2-part video, so I'm just going to talk about it until I'm done talking about what I got to say. All right? So I'll start with calories, because this is probably the question I get asked the most, which is how many calories do you eat? I will start by saying that my surgeon's recommendation was 600 to 800 calories throughout the weight loss phase. And I actually stuck to that for probably the first 10 months, maybe even 10 and a half months. It's really only been in the last 6 or 8 weeks that I've actually gone over 800 calories on most days. And honestly, I really feel like at this point it's very difficult for me to eat under 800. I don't know why that is. I don't know if it's sleep capacity, if it's just my body, but I promised myself that I would kind of listen to what my body was telling me, and my body is not happy if I'm eating 800 calories. Also, keep in mind that my surgeon's patients, most of them lose all of their excess weight within a year. I am not one of those people. I had 270 pounds to lose at the beginning of my journey. I had 230 pounds to lose from my surgery weight, so I am not the typical case. That being said, what am I at right now? On the average day, I probably eat between 850 to 950 calories. My sweet spot's probably 900 to 950. That's a normal day. I go up to about 1,000. There are days I've been over 1,000 if I'm just really hungry or it's a special occasion or whatever. And there are days that I'm under 800 still sometimes, although not that often. I still definitely pay attention to how many calories I eat, and my macros are really important to me. So how much fat, how many carbs, how much protein I'm eating. I'm not going to say the calories don't matter, but I'm one of those people who believes that weight loss is about more than just calories in and calories out. And I know that people will say, well, you know, it's just about calories in and calories out. And honestly, it's not just about that. And I mean, yeah, that's probably a whole other video, but trust me when I say it's not just about that. It is about what those calories are. Someone asked a question on Facebook about, you know, well, if your calorie goal is 1,000 calories, would you be okay with eating 1,000 calories of chocolate bar versus 1,000 calories of, you know, protein? Well, no, I absolutely wouldn't be okay with that. And I absolutely don't think that if I ate $1,000, that'd be a lot, 1,000 calories a day of chocolate bars, that I would still be losing weight, okay? Even though my calories are still, you know, being very moderated, right? There's just no way. It does matter what you eat. And I'm not a doctor, but I've been following the journey of a lot of people, and I guarantee you what you eat makes a big difference. And not just how much weight you lose, but in how healthy you are. So a calorie is not just a calorie. It's not just calories in, calories out. It's much more complicated than that. But that said, my calorie totals still are very important to me. Macros, so fat, carbs, protein, what do I try and stick at? Because that's another question I get frequently as well. So my goals would be over 100 grams of protein every day. Probably 40 grams of carbs or less. Well, no, let's say 50 grams of carbs or less. And fat, I don't really track, nor do I care much about. So I don't really pay attention, just being honest. With protein, I feel like for me, I need extra protein. People will say, oh, you only need 60, why are you trying to get in more than that? I've said it before, I'll say it again. I'm 5'10" and a half. I have a large frame. I'm very muscular. I need that extra protein. I notice when I don't have that extra protein. I notice it in how I feel. I notice it in my muscle tone. I notice it in everything. So I'm not telling you this is what you need to do. I'm just sharing what I need to do. For me, I am not happy at anything less than about 80 grams a day of protein. On the average day, I probably get between 80 and 110 grams. So 100 is my goal. I don't always get there. Sometimes I go over it. It just sort of depends. But I do really feel like protein is very, very important. And I'll talk about protein supplementation a little bit later as well. When it comes to carbs, again, I'm not telling anyone else what to do. I'm saying that for me, I need to keep my carbs on the lower side to avoid having carb cravings and because it seems to help me lose weight faster. That's just me. I ideally would like to be under 50. I would say on the average day these days, I'm probably actually more at like 40 to 60. And there are some days I'll even go over that. Normally if I go over, it's because those carbs are coming from things like Quest bars or, things with fiber. So again, for me, a carb is not a carb. The only carbs that I'm really taking in are, to be honest, mostly like artificial sweeteners and that sort of thing, which I know people don't want to hear, but it's true. And some, very little fruit, some vegetables, very little bread, pasta, crackers, rice, any of that stuff. I still avoid all that stuff. And again, I'll talk about that a little later too. I am actually looking into doing carb cycling. If you don't know what that is, I will probably make a video about it before I start doing it, but you can also just quickly look it up. I read a great book on it recently by Chris Powell, who's the trainer on extreme weight loss. Is that what it's called? Anyway, he's adorable. And I mean, certainly he didn't invent the idea of carb cycling. His book is just sort of about it. And for me, I don't think of carb cycling as a diet. I think of it as, a way of life, a way of eating. And so I think that I will start doing that. But to be honest, I probably won't start until the new year now. But I do want to give that a try and see how that goes. Right now, my eye is towards losing the rest of my weight, but also in forming a way of eating that I can follow through with for the rest of my life for maintenance. So right now what I do, I think, is almost sort of a mix of a weight loss and maintenance kind of program, which sounds weird because I'm not at goal yet, but there's a reason. Fat. Why don't I care about fat? I'm not a doctor, but I encourage you to do your own research on stuff. All the research I have read recently talks about the importance of fat to your body. Fat does not make you fat, especially good fats. Okay, things like coconut, avocado, nuts in general, and that sort of thing. Salmon, like fish oil, all that sort of stuff. I don't eat a high-fat diet by any means, compared to what most people do. But my fat on some days can be fairly high. The thing is, because fat has so many calories, if you're controlling your calories, you will be controlling your fat. There's no way you can't. If you want to read a really good book on this subject, you can read the book called, I think it's called Good Calorie, Bad Calorie. It has a piece of bread with a pat of butter on the front. And I can't remember the name of the author because obviously I wasn't prepared today. But I'll try and show it in another video. But that book is really good. It talks about how the whole low-fat thing came to be and how it came to be recommended by the government and how it is basically based on a flawed premise and flawed research. So very intriguing. Again, I'm not telling you guys what to do. I'm just telling you what I do and encouraging you to do your own research and decide for yourself what makes sense for you. But that's how my macros and stuff break down on a fairly sort of everyday basis. How much do I eat is a question that I get a lot. So I eat probably 5 times a day, sometimes even 6. I know there are a lot of surgeons out there who recommend eating 3 times a day. I don't understand why. I'll be honest, I don't get it. There's no reason, as far as I'm concerned, to only eat 3 times a day. And frankly, I think eating 3 times a day can actually be slowing down your weight loss. And this is why. your body is like an engine, right? You have internal combustion going on all the time. Your metabolism needs to actually work. And the more you eat, the more calories you burn, the more you're digesting, the more your metabolism is picking up. Eating less slows down your metabolism. Work with me on this. Almost everyone that I know in this community, when you ask them how they ate before surgery when they were overweight, they would say, oh, I skip breakfast a lot. Sometimes I would skip lunch, but then, I'd be so hungry and I would eat and eat and eat when I got home. So, yeah, to me, that says that eating less times during the day clearly is not good for you. So, by extension, eating more times should be good for you. If I don't eat 5 or 6 very small meals or snacks or whatever a day, I get really hungry. I mean, I'm a year out. My hunger is back. Is it the hunger I used to have? No. But I get really hungry. I cannot eat 3 meals a day. If your doctor wants you to eat 3 meals a day, by all means, feel free to listen to what he says. But I would encourage people to give it a try and see what happens. I'm not going to go on another doctor rant right now or nutritionist rant, but all I'm going to say is you are in charge of your own health. You make the decisions about what goes in your mouth. You do not need to feel like you're going to get in trouble or your doctor is going to give you a lecture or whatever. That is not their job. Their job is to help you and support you in your journey. You need to do what you feel is correct. And if your doctor doesn't support that, too bad. I always suggest to people that they do what they feel makes sense for themselves, and if what you're doing is right or wrong. So I don't think you need a doctor to tell you. So that's my doctor rant for this video. So that's how many times a day I eat. I eat I can eat dense protein, 3 ounces probably, 4 at the extreme most, and that would be a very uncommon day. Obviously, if I stretch out my meal, I can eat more. If I'm kind of like grazing and picking on this and that, I can eat more. I can definitely eat more than I used to be able to. I don't think that it's extreme at this point. I can eat a bit more than I used to. Sometimes I'm good at ignoring my full signal. But yeah, that's a mental problem for me. That's not a physical issue with my sleeve. So, yeah, I can eat more than I used to, but it's nothing crazy at this point. That may change. I still can't eat, anywhere near what I used to be able to eat, and I can't necessarily eat that much more than most of the people that I know that are earlier out. So that may just be me. But, that restriction certainly does help when it comes to eating. I also do try and undereat my sleeve when I can. I try not to eat to the point of being really full because it's just uncomfortable. So I suggest that too. What else is on my list? Do I weigh and measure everything? Yes, I still weigh and measure everything when I can. Sometimes it's not possible. And sometimes I will weigh and measure things ahead of time so I can just grab them out of the fridge. But if I'm eating leftover chicken or whatever it is, I'm going to grab it out of the fridge and I'm going to weigh it. I actually don't measure very much. I normally weigh because it's a lot more specific and yeah, whatever. It's a lot more, it's easier to cheat when you're measuring things. I'll just put it that way. But I do sometimes measure if it's something that is easier to measure or whatever. But yeah, most of the time I still weigh and measure. I am pretty good at guesstimating if we're out or I'm at someone's house, but I weigh and measure as much as I can. Do I still track? Absolutely. I track every day. I tracked when I was on vacation, on a cruise ship, you name it. I track every day on MyFitnessPal. That's the app that I use. Obviously, there's tons out there. There's Lose It was another one that I know a lot of people use. I don't care how you track. I don't care if you write it down in a journal. Everybody knows. I think tracking is super important to this journey, to being successful. And I'll talk about that later in the week as well. But I absolutely believe in tracking. I will continue to do it even post-goal. And I definitely still do it now. So I'm at almost 15 minutes. So I'm going to cut this video off and then we'll go to part 2. See you in a bit.